Dr. Matthew Oughton is with me. He's been a big part of our COVID-19 coverage lately, an attending physician in the Division of Infectious Diseases at Jewish General in Montreal. Dr. Oughton, thank you for being with us so early. I appreciate your time. I have a lot of questions for you. Can we begin? Let's just, what the information we know about how COVID-19 affects people so far, based on the research we know. The U.S. president is 74. He is overweight. He is not a big follower of exercise. He does golf, but that's pretty much, we believe, his fitness regime. To what extent might he be at greater risk?
As you pointed out, his age of 74 and his relative physical inactivity and his obesity. He's actually clinically obese from the official numbers that have been released. His BMI is at least 30, although I don't think he falls into the morbidly obese category. But those three items are all risk factors for more severe disease. So this is something that he and his medical staff, I think, are going to have to watch very, very closely. To me, the big question at the moment is how far along in the disease course is he? Did he get this from his advisor, Hope Hicks, who was with him a few times in the last few days on flights? Or was there some other source that has exposed Hope Hicks, the president, his first lady, and others, perhaps earlier, which means he might be later on in that course?
Exactly. Now, the exact source of infection has not been released. Perhaps they don't know, but they certainly have not released it publicly. But Hope Hicks, his closest, or one of his closest advisors, with whom he has been in Marine One and at the debate on Tuesday, at the campaign stops on Wednesday, tested positive. That confirmation coming earlier in the evening. So if we were to look at the timeline then, Dr. Oughton, I mean, was he infected before the debate? If there's that 2 to 14 day incubation period, we could be talking about a far different scenario here, couldn't we?
That's correct. And the reason that, to my mind, that would be useful to know is that if it was really from one of these flights that he was with Ms. Hicks on either the Wednesday or even more likely the Monday, then this would mean that he's just at the very, very beginning when symptoms are likely to be at their least, at their mildest, and that it will be really the next several days where we'll see whether he falls into the category of people who get the usual sort of typical symptoms, the fever, the cough, the shortness of breath, or whether he's one of the people who falls into the less symptomatic category, or occasionally there are people who get more symptomatic more quickly, especially those with risk factors.
So when his White House physician, or the presidential physician, Sean Conley, says, I will maintain a vigilant watch, obviously we're not in the White House, but what kind of care do you think the president is getting at this time?
I would think that the key thing, as with any patient who has COVID, is first to look for symptoms. If there are symptoms that develop to the point that the person is feeling very unwell, then under most usual circumstances, that person would seek medical care. And especially if the person had several risk factors, you'd probably want to do some investigations early on, including there's a large panel blood test you would usually do to get a sense of where things are at, certain markers of how much inflammation might be existing in that symptomatic person to at least establish a baseline, usually chest x-rays, things like that. But again, if he is much further along, if this disease has already been developing over several days and he remains relatively well, there's less need to go on to that level of investigations. But if he's very early on, then, as they say, anything could happen.
I did note, just as an aside, the White House uses the Abbott rapid test that was just approved for use in Canada, and he would have been tested a number of times to confirm that result. Positive diagnosis for the U.S. president and the First Lady. And I'm with Dr. Oughton from Montreal as we continue to bring you special coverage. I have a couple of other questions about others potentially affected by all of this. At the debate, there was Joe Biden on stage. They were at a distance on that stage, but obviously not able to wear masks. We understand, I mean, Joe Biden's made no secret of the fact that he is tested weekly, that he takes tremendous precautions. We see him in the mask regularly, but as we look at this picture, Dr. Oughton, at that distance, over a prolonged period of time, to what degree might the vice president be at risk here?
So I think the key preventative factor there is really that of their distancing. And I didn't see anyone with a tape measure there, but I'm going to assume that they were quite a bit more than the usual 2 meters of physical distancing. I guess if you want to look at the other side, the vice president is certainly rather aged himself and has at least that as a risk factor. And I saw that same debate as well, and they were certainly talking not quietly, they were talking louder, which generally speaking probably emits more respiratory droplets, which probably elevates the chance at least a little bit.
All right, so again, we have had no word from the former vice president as to whether he's been tested subsequently or how his health is or anything regarding the president's health, but that's something we'll watch for today. From that debate in Cleveland, Ohio, we know the president went on the next day, Dr. Oughton, to a rally. And again, this was the day when some of the reports say that Hope Hicks was known to be, in fact, positive. Her exact timeline, again, not fully publicly confirmed. But there was the rally, and there you see there is a moment where the president, throws a hat into the crowd. We've seen here it is here. We have it on video that we're showing there. There were outdoor events, there were indoor events, there are thousands of people. There are some masks there, but certainly not everyone wearing a mask at all. So in terms of these public events, what do you think the wider risk is to people in attendance?
So if you have a public event where there's I guess in this case, the keynote speaker who tests positive, I guess it depends on his level of close and prolonged contact with those that are at the event. Usually the keynote speaker is up on a stage, usually with at least some distance between him and the large crowds. Then again, I'm not sure whether there were other periods where there might have been closer contact, handshaking, meet and greets, those kinds of things. Transient contact is not something that is typically considered to pose a high risk, but prolonged contact indoors, usually we think of about 10 or 15 minutes of prolonged contact, which could have happened as part of those events. As far as that thrown hat, certainly over the last 7 months, I think it's fair to say that the importance of fomites as transmission, inanimate objects that get contaminated and can pass on contamination to someone else, it does. I wouldn't say that it's impossible, but generally speaking, that's not a major route of transmission of this disease.
Okay, that's important too. You've answered so many of my questions. I really appreciate this insight. Is there anything that you're going to be watching for, particularly again from your infectious disease specialist perspective in the near future, in these upcoming hours?
I guess the question about what the source was, I'm assuming that much of this information will remain confidential because of, or classified because of government privacy concerns. But if he's had this for several days, then it raises into question how many of his close senior staff, both in the White House as well as for his campaign, may have been exposed. And obviously, this could create quite a large ripple effect if there's many other members who get exposed and subsequently develop this disease as well.
Dr. Matthew Oughton, thank you so much for your expertise with all of this.